Hi everyone, my name's Dhanae and I'm excited to share my research on how transient ischemic attack predicts premorbid and postmorbid verbal abilities. Transient ischemic attacks, sometimes called mini-strokes, are a type of ischemic stroke, meaning that there is a blockage in cerebral arteries that prevents blood flow to parts of the brain. TIAs are characterized by temporary blockage, where symptoms resolve in less than 24 hours. However, recent literature shows that up to 74% of TIA patients report lasting impairments in at least one cognitive domain. So, most research to date has focused on how TIA impacts executive functioning in memory domains, but there's been limited research on links between TIA and language impairments. So, I decided to focus on how TIA correlates with two cognitive language tests. The NAART scores patients on correct pronunciation of irregular words. It's often used to estimate peak pre-morbid verbal intelligence because word familiarity increases with age and education, but stays relatively stable even when individuals experience dementia or cognitive decline. It's worth noting that one study suggested NAART scores may fluctuate with minor stroke. The ASAR verbal fluency subtest scores patients on how many words they can generate for semantic and phonetic criteria. The ASAR fluency task is used for screening postmorbid impairments in verbal intelligence, especially in the areas of language and executive functioning, and this test has been shown to be affected by stroke. So these two tests give us an interesting way of looking at how TIA relates to verbal skills. My hypothesis was that group status would predict ASAR scores but would not predict NAART scores. And the primary objective for this project was to explore whether TIA significantly predicts ASAR fluency and NAART scores, and if it predicts both, whether it's a stronger predictor for one test over the other. For our methods, we recruited healthy controls from Calgary and surrounding area and TIA participants through the Foothills Hospital Stroke Prevention Clinic. All participants completed an MRI, demographics questionnaire, and cognitive testing, and data came from the larger Prevent VCI study. I also examined cerebral small vessel disease, which is based on 4 MR imaging biomarkers that are associated with cognitive impairment and vascular burden. Those markers include enlarged perivascular spaces, lacunes, white matter hyperintensities, and cerebral microbleeds. For my analysis, I built a regression model to see whether group status would predict ASAR fluency scores or NAART scores, even after controlling for differences in sex, age, years of education, mood, and CSVD. I removed race because the sample was mostly white and it was not significant. For CSVD, I included the markers individually so I could see if some were stronger predictors than others. So this project had a fairly large sample, which was primarily white and well-educated, and sex distribution for TIA participants was actually fairly good given sex differences in healthcare service utilization and diagnosis around TIA. Significant predictors for NAART included years of education, enlarged perivascular spaces, and group status, and significant predictors for the ASAR included age, white matter hyperintensity, enlarged perivascular spaces, and mood. In conclusion, my hypothesis was not supported because group status predicted NAART scores and didn't predict ASAR fluency scores. And these findings warrant further investigation because they don't align with previous literature. Demographics and education were more associated with NAART scores, while markers of vascular burden were more predictive of ASAR scores, which does support previous findings. And surprisingly, enlarged perivascular spaces was the only common predictor in both models. So why does this matter? Well, the unexpected finding that TIA predicts NAART scores but not ASAR fluency scores suggests that the relationship between TIA and language domain is more complex than we would expect, and that NAART may not estimate premorbid verbal intelligence for stroke as accurately as it does for other neurological conditions. TIA predicting NAART scores beyond the vascular burden markers suggests potential pre-existing cognitive vulnerabilities that are associated both with lower verbal skills and increased risk of TIA. And finally, the significance of the CSVD markers supports their utility for clinical and research assessment. Specifically, enlarged perivascular spaces appear to be a potential marker of both current and premorbid verbal abilities and should be explored further. Thank you to Dr. Longman, Dr. Barber, and the Stroke and Cognition Lab, and thank you for listening.